Good evening, ladies. Happy Wednesday evening. Hopefully you've had an awesome Wednesday and welcome to Wellness Wednesday once again. Um, it's been a strange summer. I think we've had a really nice summer, and I'm just hopeful that we can enjoy a little bit more and get into fall with little to do. I am just grateful for the weather we've had and that we've been able to enjoy so much of the outdoors. Hopefully you have too. I want to just start by giving my disclaimer. I've got to do that every single time I do a live event on Facebook. Anything I say tonight is just health information. It should not be taken as specific health advice. Do not start taking or stop taking or change the way you're taking any of your medications. And if you feel like you really need to, please consult with your prescribing practitioners so that they can help you make the appropriate adjustments. And also, attending this Wellness Wednesday does not establish a doctor-patient relationship. Okay, so I want to announce for those of you who may be new to the group about the masterclass that I will be giving on October 2nd. And it's going to go through October 6th every evening, 7 p.m. Pacific, 8 p.m. Mountain Time, every evening for about an hour, maybe a little more each evening. And just a few things that we're going to be covering during that class. We are going to be really delving into a lot of different topics, but I'm going to teach you why women, with low thyroid lose their hair. Several reasons, 5 main ones. I'm going to talk about how to move beyond the thyroid numbers and lab numbers so that and give you some actionable steps that you can use to never fail again. We're going to talk about how this is not, you should not believe that it's all in your head, that it's just because you're getting older, that you need to accept your new normal. This is all garbage. So kind of getting into that, we're going to talk about the topic tonight for Wellness Wednesday, that is depression. And I think those of you who are here and who have attended my master class in the past will say that this information is life-changing and super valuable. It's going to be, like I said, it'll give you tools and actionable steps that you'll be able to use right away to change your life. So here we go. Wellness Wednesday topic, depression. It's a touchy topic for sure. It can certainly be very stigmatic and very misunderstood. And indeed, unfortunately, your doctors kind of reinforce this, and we're going to talk more about that. But most of us think about depression as having symptoms of feeling sad and feeling low, feeling unmotivated, feeling apathetic, feeling like you want to self-isolate, just kind of keep to yourself. Maybe you're tired, deal with brain fog and memory issues. Maybe you're slow moving. Maybe it's hard to really just even get moving physically. But some of the other symptoms that are much more worrisome certainly would be feeling hopeless and lost. Like there's nothing you can do. Like you're overwhelmed, so overwhelmed that no matter what you try, you just get lower and lower. Even to the point where sometimes you feel like there's no way out. And even for some of you may have even felt suicidal or, had got so bad to the point where you have delusions, meaning maybe false ideas about what you see in reality. And doctors often, unfortunately, reinforce the wrong idea. And I'll get to why that is in a minute. But you're often made to think that because your numbers, your thyroid lab numbers are normal, that maybe it is all in your head. Maybe it is just, things that you're not doing right. And because certainly doctors pull out their prescription pads at this point and, write prescriptions for antidepressants and anti-anxiety medications. And it's like, that's the only other answer when they can't explain to you why you're tired, why you just don't feel like getting out of bed sometimes, why you don't want to be around anyone. And so of course, this results in a lack of confidence and sometimes indecisiveness. It's not a good place to be, as some of you may know. So doctors reinforce this, like I said, by telling you that you're fine when your tests are normal, and you begin to feel like it's your fault, or they make it seem like it's your fault, that you're a hypochondriac for thinking that something's wrong, that something's, and so we know that depression can be real. All right. We know that there are certain that there are causes for this. We know that traumas, physical, sexual, emotional, traumas often lead to this, often lead to these symptoms. But there's an underlying widespread cause that we need to consider. And there are kind of sub-causes for this, and where, yes, stress may be a cause, but what type of stress and how you deal with this stress really depends on the underlying metabolic imbalance. When I say metabolic imbalance, what I mean is your cells, your tissues are not able to generate the energy that they need to function properly. So we're talking about adrenals, your brain tissue, and nerves. We're talking about other organs that are malfunctioning because they can't make the energy that you need to help the rest of your body function, to help regulate glucose. So your liver function can be depressed. It can be less. Certainly, we've got to talk about these causes. So these conditions that affect the way your metabolism works, because if you are going to thrive and feel happy and hopeful and able to be in control and to take care of things and motivated, your brain has to make energy. Each of your neurons and the connections that they make between, among each other, depend on the energy that your brain cells can produce. So metabolically, we have low thyroid, diabetes, and other things like parasites, because they rob you of your nutrients that you need to make energy. Certainly just nutrient deficiencies in general because of poor nutrition. You're not, maybe you're not eating right. Maybe that is part of the cause, but or maybe it's the way you were brought up and the way you were fed, and so while we have to consider all these different causes, I want to focus on the thyroid piece, because that's often when, or the reason why doctors get this wrong. They keep checking that one marker, the TSH, and when it's normal, they say you're normal, you're okay. And so any other symptom that you're having, despite that number being normal, it's got to be something else, or it's in your head, or it's it's depression, anxiety. So if it's depression, they give you an antidepressant. That's the fix. And how often does that work? And they go round and round with it. They keep trying. So if you don't react well to that one, they try another one. And so many of you have been through these medication after medication cycles, and it just gets really, I'm sure, gets really old, because I know when I was practicing family medicine and doing the same thing, it was getting old going after this with different patients. Like, why wasn't this working for you? This should be helpful. This should work. This should help you be happier. Help you have more energy. I knew from the other side. I know this from the other side of it. So low thyroid, because they're only looking at one test of the many tests that there are, and I'm going to be covering this in depth in the masterclass coming up. They're missing the whole picture. They're only getting a small part of the picture. And so because they deem or determine that it's not your thyroid, it's got to be that you're depressed. You're tired, and you've got this brain fog, and you're not thinking clearly, and you're having trouble making decisions, and you're slow moving, and all of these symptoms that I mentioned warrant a diagnosis of depression, I guess. But no, that's not the way it has to be. We know that there are causes. We need to determine them. Some of the other causes for depression, like I said, hypoadrenal function, so low adrenal function. You got to have cortisol to give you some pep. That cortisol is your stress hormone. It's got to kind of light that fire into you every now and again. Like first thing in the morning, it should be higher, and then it drops down throughout the day. Normally drops down and low enough that you can go to bed at night and sleep. But when you don't make enough cortisol because of all the chronic stress that you've been under, and certainly some of these other things, these traumas and things that are really stressful, yeah, I get it. But if you have an underlying metabolic deficiency, like your cells don't function, it's because you just simply don't have the energy in your cells to function properly. So instead of this always being an emotional type depression, this is a physical depression. Your energy is depressed. Your ability to move quickly is depressed. It's a physical thing. Your ability to care is depressed because it takes energy to care. Your ability to do things, to start things, it's depressed because you lack the energy physically. And I can see how it's easy to then make the leap to an emotional depression from that state. If it goes on long enough, sure, because you don't know any better. You lack the confidence that you can even find the answers. And so, of course, you're going to start getting the emotional piece, and that wears on you. And so, like I said, this is not your fault. You've been misunderstood. You haven't been listened to very well. A couple patients I want to tell you about. I want to tell you about Sandra, who came to me with all of these types of symptoms. She was sad. She was depressed. She was tearful a lot. She was tired, just tired. She worked from home, and it was all she could do to get through her workday before she crashed on the couch. She didn't want to be around anybody. She really had isolated from herself from family and family events. And she had diabetes. She had Hashimoto's. I should say Hashimoto's hypothyroidism. And as we went through and helped her fix these problems with the right plan, the right approach, you could see things change in her countenance when she would visit with me. I saw her smile more. I saw there was just more alertness in her. There was life coming back into her countenance, into her face. She was losing some weight. This was good for her. She was really starting to thrive instead of just survive, which is what she was doing before. She ended up getting off all her diabetic medications and got off her antidepressant. And she's doing so much better. It's so fun to see her now. She's a new person. Lenora came to me with some symptoms that were kind of that were worse. She had been diagnosed with bipolar. She would go really low and then really high. And when she would go really low, she admitted that she had these thoughts of suicide. And she said that she would never do it. She would never end her life, but she was tired of those thoughts. She had, as a Christian, she just knew that wasn't the right thing to do. But she was tired of the thoughts. These plagued her when she got so low. And she had resorted to taking strong medications for mood stabilization. You might have heard of lamotrigine or Lamictal. And she was on another antidepressant apart from that. I forget which one. It might have been fluoxetine, Prozac, or it might have been Cymbalta. I honestly don't recall. And she was able to work through her causes, her root causes, fix her thyroid issues. She didn't have diabetes, but she had insulin resistance. So fixing that was key to her metabolic dysfunction. She used to be so irritated by her family's political views because she didn't share them, and they would stress her out terribly. I just happen to remember this part because it was pretty poignant when she would explain this to me. And what was even more impressive was when she got to the point where she could tell me that didn't bother her much anymore. She was able to put things like that aside and focus on listening to them and being the mother and grandmother that she wanted to be, that she had always hoped to be. So anyway, I wanted to share those successes because that's what really can happen if you get to the root causes, you know, you can overcome these. You can get your energy back. You can care. You can resolve the brain fog. You can move quicker. You don't have to be sad. You don't have to you can be motivated again. So, okay. I think I'll leave that there. I want to again emphasize masterclass coming up October 2nd through the 6th, 8 p.m. Mountain Time, 7 p.m. Pacific Time, every evening, Monday through Friday. We are going to have a ball. We're going to learn a lot. I'm going to give you so much helpful information. And tonight, I just want you to remember that in order to fix these problems, you've got to learn about the right testing. You've got to have a comprehensive diagnosis, not a misdiagnosis, you need someone who can actually hear you, who actually hears you and listens to you and can put it all together for you and help you get out of this hole you're in. All right? So have hope. There are answers, real answers. You still have the power to heal. Ladies, have a good evening and take care.